Good afternoon and welcome to this COVID-19 briefing on our response to the Delta variant. I'm Robin Kaler, Associate Chancellor for Public Affairs. Today we're going to talk a little bit about what the university is doing to respond to the Delta variant and why we have chosen these approaches. You've been asking us a lot of questions, as always, which we greatly appreciate. And over the next hour, we're going to try to answer as many of them as we possibly can. Also, as always, we will have an archived version of this briefing that we'll post to the covid19.illinois.edu website, and we will email you when that is all ready to watch. Our panelists today are Chancellor Robert Jones, Vice Chancellor for Academic Affairs and Provost Andreas Kangelaris, Deputy Administrator and Epidemiologist at the Champaign-Urbana Public Health District, Awais Vade, Associate Professor of Epidemiology, Rebecca Smith, and Associate Professor of Microbiology, Chris Brook. We're going to start with some brief opening comments by Chancellor Jones and then get right to your questions. So Robert, would you like to share some opening thoughts?
Yes, let me start by saying thank you, Robin, and thank you to our panelists for sharing your time, your knowledge, and your expertise with us this afternoon. And I also want to welcome everyone back to the opening of the fall semester. I'm sure you all would agree that it's very exciting to walk around the quad or any place on campus because you can certainly feel firsthand the excitement and the energy that comes with returning to face-to-face instruction, which we haven't experienced in about 18, 20 months now. And so we're very, very excited about that, as our students are. And it is also gratifying as we walk around campus to not only see that excitement, but I am very gratified at the level to which people are being compliant with the mask wearing mandates that are in operation. But also, just like we did last year, when the mandate was to wear them outside, and even though that's not the case this year, a lot of our students and members of our communities are wearing masks outside as well. And so I think this is very much symbolic of the fact that our students and our faculty and our staff really have embraced the commitment to take every step required to help protect our entire community during this pandemic. I think that the arrival and the effectiveness of these free and readily available vaccines, in conjunction with our now well-established testing, tracing, and ecosystem, has really provided us with the opportunity to start the new year in a very, very impactful way, to start in person with this residential learning experience again. And as we've seen in the past few weeks, this pandemic is far from over in our community. So we don't want anybody to think that we have transitioned out of this pandemic. But I do not know what the situation might look like in the months ahead or the weeks ahead. But I can tell you, I am truly optimistic at the high and growing number of our faculty, staff, and members of our community who are vaccinated. The vaccination rates continue to increase each and every day for our students and our faculty and our staff, and which is also backed up by testing protocol. So it really gives me some great degree of confidence that we will be able to continue our in-person instruction while at the same time keeping every member of our community safe. But clearly, there are going to be some surprises and some twists and turns along the way. And we will do what we've always done for the last 18 months, and that is respond as quickly and as thoughtfully and as transparently as we can. But as was the case last year, I am going to ask everyone to have patience and for all of us to demonstrate empathy and kindness as the hallmark of what we do here at Illinois. I am so happy to be here with my colleague, Provost Andreas Kangelaris, and two of our experts from our SHIELD team, and one of our dear colleagues from CUPHD, to talk in more detail about the implications of the Delta variant and to explain some of the really scientific and research facts and guiding principles that we're utilizing to respond at this point in time, and that will continue to guide us for the rest of this academic year. So with that, Robin, I'll turn it back to you and we can get the program started. Thank you very much for joining us today.
Thank you, Robert. And with that, I'm going to start with you. I think with the most foundational question we could ask today, and that is simply, how does the university make decisions about COVID-19 protocols?
Well, I think as you've heard me say time and time again, the overarching and the guiding principle is to keep everyone in our community safe. So we will continue, as we have for the last 18, 20 months or so, to follow the guidelines and the guidance from the CDC, IDPH, and CUPHD, and the advice and counsel of our own SHIELD team, who are constantly, I'm sure there's not a day that goes by that they're not looking at the latest evidence, publication, what's going on across the state, across the nation, and across the world. And all of that is used to give us the big picture as we think about how we will continue to keep this community safe and to take in account the entire ecosystem that we have developed here. So we have the vaccinations, we have the saliva testing and contact tracing and the digital technology. And now that we have all of that in line, it does give us the opportunity to respond in a very thoughtful, scientific, data-driven way. And it means that we oftentimes will have to pivot pretty quickly. And I know at times this can be very, very frustrating and sometimes confusing. But I believe we have the best data, best knowledge base that informs each and every one of our decisions. And the knowledge is deep and wide enough to allow us to make decisions in a timely fashion as quickly as we can and with great transparency. And we hope that we will continue to get the great response from our faculty, staff, and students that we've received for the last 18 months or so.
Great, thank you so much. And I want to echo your thanks earlier to Dr. Awais-Vaid. We are so grateful, Awais, to you and Julie Pride and all of your colleagues at CUPHD. It has been a blessing to have you in our community. And we hear when we talk to our colleagues across the nation that this is not the norm to always have a wonderful partner in all of your local leaders. And we have been so blessed with that. And you guys have been a major part of it. So thank you very much. But as our public health expert, can you tell us about what the Delta variant is doing right here in Champaign-Urbana?
Thank you, Robin, again, and thank you for inviting me back for one of these Q&A sessions. On behalf of public health, I do want to thank the organizers and the administration for making communications and transparency one of the top priorities. I think that's very important. But before I answer this question about the Delta variant and what it's doing in our community, I do want to emphasize one point, which I think is a take-home message for me and hopefully for a lot of people on this who are hearing this as well. And I think that it's very clear to all of us now that this third or the fourth or the fifth wave that we are talking about in the United States, this is clearly a pandemic of the unvaccinated. Majority, if not all of the deaths, all of the hospitalizations, all of the ICU admissions, and COVID complications are happening in the people that are not vaccinated. And we have enough data, enough proof, enough of people talking about this. So we do know that. Additionally, the healthcare system, the healthcare professionals, public health professionals, and first responders are exhausted. And I think, I mean, it's I cannot specify that enough. They're exhausted for the last 18 months. And we are exhausted now because of the actions of people who are choosing not to be vaccinated. So I think that's important to mention as well. And, I talk to my colleagues in public health and in the hospital sector all the time. And like I said, they are tired of taking care of people who are making this choice of not getting vaccinated. And we also know the largest, exodus of healthcare professionals out of the field is happening right now. It's very hard to get people hired. And if people think that we can wiggle our way out of this pandemic, without vaccinations, it's not going to happen. The alternate is going to be a few 100,000 more deaths. we cannot afford that. So I think that is important. Vaccines in the past have saved lives. They're saving lives today. And in the future, they're going to save lives as well. So that is a very important take-home message. I'm going to come back to your question about the Delta variant in this community. Majority of the cases, I would say 90% or more in our community right now is the Delta variant. We know that because, serotyping has been done at the labs on campus, at the state lab, and we have also seen the typing done through the sewage program that is being run in partnership with the U of I as well. So we have seen Delta variant in this community. Majority of these cases are happening among the young individuals. More than 50, maybe 60% of all our current cases are in the population under 30 years of age, which was not true, when this whole thing started. We are also seeing some cases in the long-term care facilities and nursing homes. And unfortunately, most of those cases are happening because the staff over there, some of the staff over there decided not to get vaccinated. And also some of the visitors and the guests that are coming in are not vaccinated. And unfortunately, again, some of the deaths in that population has happened because of that. So it's everywhere in this community. It is spread across every demographic. It's in small towns. It's in Champaign-Urbana as well. So I don't think it is that anybody can say that they are spared from the Delta at this point of time. And again, I know Becky and Chris will talk more about this, but Delta is spreading much faster, and it is affecting a lot more people as what we saw with the other variants as well.
Thank you, Awais. That was very sobering, but very relevant. I appreciate that additional information. And yes, let's talk to Becky now a little bit about how is the Delta variant different from the other variants based on what we know today.
Thank you, Robin. The primary difference between Delta and the previous variants is how quickly it spreads, and specifically that the incubation period, that period between infection and infectiousness, is very short, about a day and a half. And that's why we're so concerned about the Delta variant, because with the previous variants, you would see maybe 30–40% of infection would happen before symptoms occurred. With the Delta variant, it's closer to 75%. That is why we are requiring unvaccinated individuals on campus to test so frequently, because we know that how much infection can happen in just a short period of time.
That is frightening. Chris, anything to add to what Becky said?
Yeah, I'd like to second what Becky just said. This virus is much more contagious than the Alpha variant that was circulating back in the spring, and is much more contagious than the virus that was circulating last year. We don't totally know why that is, but it absolutely is the case. So it's a different situation than we had last year.
Yeah. So what about the effectiveness of the COVID-19 vaccine and the COVID-19 tests against Delta?
Yeah, so luckily they're both highly effective. So the testing methods that are available, either PCR tests like our COVID Shield saliva test that we developed on campus, as well as rapid antigen tests like you can pick up at CVS, work just as well against Delta as they have worked against the previously circulating viruses. And similarly, thankfully, the vaccines retain their high degree of efficacy against the Delta variant. So they still protect against severe infection, hospitalization, and certainly to some extent transmission. And so while there's been a lot of focus on breakthrough infections recently, the data are still very clear that the vast majority of cases, of severe cases, in this current wave are amongst the unvaccinated.
Yeah, absolutely. And Becky, a lot of us, yourself included, I know you've been a major leader throughout this, have been working throughout the summer and the early fall into getting ready for the semester. And we had to do some pivots pretty quickly recently. Can you talk a little bit about how the emergence of Delta had to shift our approach for the fall 2021 semester?
Sure. And I'm going to start with just some of the basics of how we think about disease control. We usually think about this layered approach that not one simple solution. There's no just one thing that works for everything, but we combine different approaches. So you might have vaccines and testing and masks and ventilation and distancing, and we combine those in a way to bring infectious disease spread under control. When you have a certain virus that has a certain amount of infectiousness, there can be multiple combinations of controls that would be effective. When the infectiousness of the virus increases, you have a choice. You either add in more layers, more controls, or you make the existing controls stronger. Now, luckily, we had vaccines come in. That's another layer of control that's been very, very helpful. But because Delta is so infectious, we had to add in and strengthen the other layers that we had because the vaccine alone would not be enough. So we really need to double down on some of the things that we're doing and make them a little bit stronger to deal with that increased infectiousness of Delta. And that means wearing masks in more places, especially indoors and in crowds, having really good ventilation. We know that on campus, we've done a lot with ventilation, but in your personal housing and where you're going, you might want to make sure that the ventilation is good, the windows are open, moving it outside. And social distancing is back. Unfortunately, we need to think about who we're interacting with and limiting our social networks a lot more.
Absolutely. And Owais, you said earlier, this is an epidemic of the unvaccinated. We get the question a lot. Can't I just test frequently? Isn't that just as good as being fully vaccinated?
You know, testing is great. Testing has been always a great public health tool. We've used this for decades and decades and decades, and we've used this throughout the pandemic as well. It is great for identifying cases and to be able to limit the spread of infection to others. So basically, testing does not prevent you from the infection because you already are infected, but it does prevent others from getting infected. Whereas vaccines, on the other hand, it protects the person from getting the disease. The current vaccine, it may not be perfect in limiting or the spread of infection, but as you've already heard, it does a very good job of preventing the disease, which could lead to complications, hospitalizations, and death. And I think in our community, the focus should always be for vaccinations, because I know that the more people that we get vaccinated, the less and less infections we'll see, or the less and less, fewer and fewer disease we will see going forward. But testing should be complemented. And CDC has very good guidance on testing in communities which are very well vaccinated. And then you also look at local trends. And if there are clusters and outbreaks, then you do targeted testing in those locations as well. So in my mind, vaccines and testings both are complementary to each other. One serves the purpose of protecting others, and the vaccines protecting you against the disease and severe infections.
Thank you. And Chris, a lot of people, myself included, have been infected with COVID-19. I had it before there was a vaccine. We recovered. I know I went and donated convalescent plasma even for a while they still said I was had enough antibodies to do that or whatever. So we were told it provides some protection. Why is that not the same as getting a vaccine? Can you explain the theory behind that?
Sure. So you're absolutely right that when you've recovered from COVID-19 infection, in most cases, you are going to be protected to some extent against reinfection. I mean, that's how our immune systems work. The problem is there's still a great deal of uncertainty about the strength of that protection, the duration of that protection, and how it compares to the protection conferred by vaccination, which we know is extremely robust and long-lived. And so because of that uncertainty, the current CDC guidance is that people who have recovered from COVID-19 infection still should get vaccinated. And that's partially driven by the fact that there are really solid data showing that people who've had prior COVID infection and then subsequently get vaccinated are super well protected against reinfection. And so there's absolutely a clear benefit to getting vaccinated after prior infection. And so that's what's driving that guidance. And I think that combination of uncertainty about the degree of protection associated with prior infection, the fact that there's data out there suggesting that there's a not insignificant subset of people who have mild COVID infections and then really have minimal protection following that. And the difficulty in confirming that people have had prior COVID infections when they think they have. All of that, I think, really points towards requiring vaccination for people, even if they've had prior COVID vaccination, is the way to go.
And I would say for those of us who have lost people dear to us, you just don't want to see anybody else in that situation, for sure. So yeah, thank you. Becky, so if we're not requiring people who are fully vaccinated to test, how are we monitoring COVID-19? Because we've said you can still get a breakthrough case and you can still infect other people at some level. So what do we do about Delta and COVID-19 among the vaccinated in our community?
So we are requiring some people who are fully vaccinated to test. We are using an approach that was very successful last year, which is when we identify an address at which there have been a large number of cases, that's 3 or more cases in the last week or more than 1 case in the last 3 days, we ask everybody at that address, vaccinated or not, to test every other day until those cases improve. And usually it's about a week. Most places we can get the cluster under control in about a week. So we will be requiring some fully vaccinated people to test. We've also added 2 employee groups to that list based on an increase in cases in those employee groups. So that may happen as well. Anybody who's on that list, they will get an email from the university informing them of that decision. We used this last year to great effect. It was really helpful at bringing clusters down. We are also exploring wastewater testing for campus. Awais mentioned this, that we've used in the community and found that it is very accurate at identifying a spike in cases, actually maybe even earlier than the diagnostics can. And I know other campuses have used this very effectively. So we are exploring that possibility at this time.
That's great. And you are keeping track of positive tests that are breakthroughs, right? So how is that comparing with vaccinated and unvaccinated?
Yes, we are keeping track of the breakthrough cases as a subset of all cases. Since the first day of the semester, which was August 23rd, we had 355 positive cases. Of that, 265 were among fully vaccinated people. But given the fact that we have a very high rate of vaccination on this campus, this is fully expected. When you have a large number of vaccinated people, you are expecting most of your cases to be among the vaccinated. This does not indicate a high risk among the vaccinated. This actually indicates that the unvaccinated are twice as likely to test positive since the start of the semester than the vaccinated. This also may be artificially high because only the vaccinated who have symptoms or who think they've been exposed are going to test. So we know that we're not testing all of the vaccinated individuals. So we may see more cases among the vaccinated who are testing than we do among the unvaccinated as a percentage of the testing. We do know, though, that the vaccines are still somewhat protective against infection, and the vaccines are very protective against disease and especially severe disease. So even if they're not perfect at preventing infection, they're very helpful at keeping you healthy.
Great, thank you. And Andreas, so since fully vaccinated people can be infectious, why not just require them to get tested? We have the saliva test, it's great. Why not do it?
Well, Robin, actually, as you heard from Becky, we are asking people to be responsible and get vaccinated. We're fortunate to have this amazing testing capability available to everyone. And so in addition to the cases that Becky mentioned, as we are very good at targeting those sites where there are cases, there is a hotspot, and we make sure we ask all individuals, both vaccinated and unvaccinated, to go and test because we want to contain that hotspot. At the same time, we advise people, we strongly recommend to people, hey, look, if you find yourself having some symptoms, go and get tested. If you find yourself in an event where you feel there were too many people, first thing you need to consider, go and get tested, even if you're vaccinated. And of course, travel. I will tell you, I do that all the time. Anytime I travel somewhere, I come back to campus, the first thing I do is I go and get tested. We are fortunate to have this ability to have access to testing at scale for free. And I will say that, as Becky pointed out, we are monitoring things and we are ready as we, through those people who get tested, those people who are unvaccinated, and we monitor them through testing. We want to make sure that anytime the situation is such that we need to get more people to get tested, we will do that.
And can you talk a little bit about what some of those metrics are that we use to inform and guide those decisions?
We use all the metrics you can imagine. We have actually the right experts here to share with you the metrics we follow. The first and foremost is, of course, we are monitoring our community. We know those students who are not vaccinated, those faculty and staff who are not vaccinated, and through their testing, we monitor where they are and the environments where they go. And that is something that provides us with the ability to follow the pandemic on campus. In addition to that, we work very closely with CUPHD. We work very closely with the healthcare providers. So I would like to ask Becky and Awais to share with us some of the things they're monitoring as we go about making sure that we know what is happening with regard to the variant in our community.
Sounds great. Becky, would you like to go first?
Sure. So we look at the data every day and we're parsing it in a number of ways. We're looking at the addresses, like I said, to look for clusters within a certain address. We're looking at vaccination status to see what percentage of breakthrough cases we are having and if it's something concerning. We are looking at what we expect on the numbers as a week-by-week basis compared to what our modeling would tell us to expect, so that we know if something's out of whack with what we expect from our models. And I know our models aren't perfect, but they give us an idea of whether we're on the right trajectory or not. And we can keep an eye on all of those factors and see if anything's out of line with what we already expect.
And Awais, how about CUPHD's perspective on this?
Sure. So Robin, one thing you do know that the CDC and IDPH provides guidance and some of the mandates for COVID, but we all know that the response is local, right? So the responsibility of the COVID response is on the local authority, which is public health here. And from the beginning of this pandemic, we have been monitoring trends in our community from day one, and we have been sharing that information as well. So the things that we specifically look at are absolutely the rate of new cases. We look at demographic profile of those cases. We do look at clusters of cases, and we also look at exposures or where they are happening in our community. Plus, we also pay very close attention to hospitalizations, ICU admissions, deaths, as well as healthcare capacity. I mean, I think it is very important for us to keep track of where our healthcare system capacity is right now. And so, you know, we meet with our partners, the healthcare community partners, on a weekly basis to get input from them. Sometimes just data is not enough. You know, we need to talk to people who are on the front lines. Like I said earlier, healthcare providers, first responders. These are the people that are on the front lines, taking care of the sick people, responding to emergencies. So we talk to them regularly, and I know the university administration have been part of all of those discussions with us as well. So I think it's a lot of things that we keep monitoring. For the last 6 months, we have been also monitoring vaccine trends in our community or at a demographic level. So we now know which neighborhoods, which zip codes, which small towns have high vaccination rates versus communities which don't have very high vaccination rates. Again, all of these things are done so that it can help us strategize. It can help us communicate with our partners so that they can, plan for the next few weeks, the next few months. I think those are all the things that we have been doing consistently for the last 18 months.
Thank you. And Robert, until the pandemic ends, we know we need to continue with the layered approach Becky described, or as Brian Brower calls it, the Swiss cheese approach. And we've had in the spring and the fall, we had wellness support associates at all of the classroom building doors to check people's Safer Illinois app. We don't have them at every building this year. We've got a little different approach. Can you talk a little bit about why we don't have them at every building and what the approach is instead?
Well, let me just reemphasize, Robin, you're absolutely right. The WSAs were a critical part of the ecosystem that we created last year outside of every classroom building. But as you can imagine, with having everybody back to face-to-face instruction, it makes it very, very challenging to think about hiring enough people to cover the hundreds of classes that we have going on concurrently. But the WSAs are still on duty. They are conducting random spot checks of access to building and various classroom buildings. That is going on this semester and will continue for the rest of the academic year. We currently have about 320 wellness support associates, and we are definitely trying to hire more. So if any of you that are listening know someone, or if you're interested in a part-time job, please reach out to us and let us know, because it's challenging in this period that we're in now to really find enough people to fill these critically important positions. But the other thing that we're doing to make sure that we have more than adequate, hopefully adequate coverage, we're also permitting supervisors, professors, academic advisors, healthcare workers, and others, professors, to ask someone for their billing access status. And we're doing this in addition to the WSAs. So we have a broader swath of people who are checking the status of our students and our staff. The university is also monitoring daily test logs for compliance. And after one missed test, say for students, they are sent out a text message letting them know that they're out of compliance. And we're also in the process of developing a similar system for faculty and staff as well. So we are doing all that we can to make sure that everybody in our community is compliant with our vaccination and our testing protocols.
And of course, classrooms are a place we have held as one of the safest places to be throughout COVID. Becky, can you talk a little bit about how we're responding to Delta in the classroom to make sure classrooms are safe?
Of course, we're taking that layered approach to heart there in the classroom. So we have the high vaccination rates and we have our testing ecosystem. The indoor mask mandate is really important for us there because we know that masks are very effective for controlling spread indoors. And our facilities crew have done an amazing job improving ventilation in all the classrooms across campus to make sure that they are as high and up to date as possible, because we know ventilation is a huge part of limiting the spread of this virus. And all of the other things that we've mentioned, all of those, we're trying to make the in-person classes as safe as we can make them.
Great. Now, Andreas, can you talk a little bit about why we are wanting faculty members to stay in person and not move classes to remote status?
Absolutely. Well, first and foremost, that's what the students told us they want in large numbers, and they're in large numbers back on campus. And I know all my colleagues are very excited to be able to engage with our students again. And because we anticipated there would be some cases where some faculty may need to consider changing to remote teaching, we provided the process we want them to follow. And that process requires them, if there's going to be a need for modality change in their course, they need to work with their administration to make sure that that modality change is well justified. The process is very robust. It involves the various conditions that we expect a pandemic and the consequence of it may create. And it is the decision of the unit to allow for that modality, change of modality to happen in appropriate consultation with ADA as needed. The most important thing is that process allows us to engage with the students and their families and let them know about this change of modality. If we follow that process, everybody knows that the university remains committed to the residential experience that the students want. And so far, what we see is that the majority of our units are very committed to making that happen and staying the course.
Thank you. And Robert, I know you and I, all of us are so excited to see all the students back. It is good for all of our souls, I think. And as you've said many, many times, our number one priority is keeping students safe. So can you talk a little bit about how many rooms we're reserving to help those students and support those students who might need to isolate or quarantine this semester?
Well, that's a absolutely critical part of our strategy for those that test positive and needed to be isolated or quarantined. At this juncture, we have about 150 to 200 rooms that are specifically dedicated to isolation and quarantine. And we've been partnering with ZU PhD for additional space if needed, with the important emphasis on the words if needed. We're very, very fortunate at this point to not have a large number of people in isolation or quarantine. So we are in good shape at the moment, and we certainly hope that's going to continue for the rest of this semester and the rest of the academic year. The university also provides daily services to transport students who need to be isolated from their residence to their isolation or quarantine space. And so we are very well prepared. And I know some of you probably read or heard about the fact that we cancel reservations in the over in the hotel in the Illini Union. We cancel reservations to make sure that we had enough space there in case it was needed. So we're doing all we can. And at this juncture, we think that we're well prepared to handle isolations and quarantines.
And another question that we get asked a lot is, and you alluded to it earlier, is what percentage of people on campus are vaccinated? Can you kind of walk through the different groups of folks and tell us how they're doing?
Well, this is something that we're increasingly proud of, and it's a moving target. Thank God it's changing every day. And so as of this morning, we had about 91% of our graduate students that were vaccinated. Slightly higher than about 90% of our undergraduates. And for our faculty, 83.4% of our faculty are vaccinated, and about 88.8% of our academic professionals, and about almost 68% of our civil service. So we still have some work to do in certain categories, but I can tell you unequivocally, those numbers change every day. And we certainly hope that by next Wednesday, when we will be reporting out the final number of vaccinations, and based on the mass mail that we sent out last night, we certainly hope that's going to be the impetus for more people to go out and get vaccinated. So I'll say what I said a few weeks ago. I'm absolutely convinced that in aggregate, we will be over 95% of vaccinations among our university community. So make sure I'm accurate on this. If you're not vaccinated, please go out and do so.
Absolutely. Here. I second your motion. Of waste, can you talk a little bit about, now that we have vaccinated people in the population, it sounds like contact tracing is a little different, and I'm not totally up to speed on that. Can you walk us through that?
Sure. First, actually, I want to congratulate and express my gratitude to the campus community for this vaccination percentage. Once again, U of I leading and leading by example, not just for universities but also for the community. This is how things are done. So keep up the good work with that, and I'm sure as well 95% you guys will be the first ones to do it. So as far as case investigation, contact tracing is concerned, CU PhD still leads case investigation, contact tracing, but we are doing more and more in partnership with the university, with K through 12 schools, with the healthcare system partners, and with businesses as well. And as cases grew, we found it to be most efficient to partner to be able to identify close contacts much faster. So that has been a process that has been going around for almost 6 to 8 months right now. Contact tracing still continues 7 days a week. Our goal has been, it has always been, to reach cases within 24 hours from the time we get the lab result. We cannot act on anything unless we have seen the lab report come into our system. And sometimes there's a delay in the lab. So again, asking people to be patient, because we have to see the lab report to begin our investigation. But within 24 hours, we try to reach out to pretty much everybody that is tested positive that day. And we have been able to keep up with that. Additionally, now we have the assistance of the state search center. So on days where we get overwhelmed, or we have a lot of our own staff call in sick for whatever reason, we can ask assistance from the state search center, so that we are not falling back on our goal of 24 hours of the case investigation. Regarding contact tracing, I know we got a lot of questions. Who is getting contact traced? Who is getting the call? Who's not? Things have been changing. COVID's evolved in the last 18 months. Things have changed a lot. And so are the rules around contact tracing. They change pretty much every few weeks. So if you are fully vaccinated and you got exposed to somebody, you don't have to quarantine anymore. It was not the same earlier. If you were a previous positive, and if you are a previous positive within the last 90 days, then you don't have to quarantine as well. So if you did not get a call from one of our case investigators, in most likely you were either fully vaccinated, or you did not meet the case definition of being in proximity of that person for 15 or more minutes within 6 feet in the 24 hours. And again, it's not any time that you came in contact with them. It has to be about 48 hours from the time they tested positive, or 48 hours before their onset of symptoms. So a lot of things go into play into that. Our case investigators are very diligent when they are calling the positive case. They try to identify all close contacts. And again, like I said, the partnership with the university, especially with the housing unit, the dining unit, private certified housing, Greek fraternities, they have been helping us identify roommates, identify individuals within the facility who would be considered close contacts. And then we reach out to them. They are placed in quarantine. And again, for those individuals who have any doubt that they never got a call from us, even though they should have, please send us an email. Our email is getting responded within hours, definitely within 24 hours. So if you have a concern, you want a response, you have any other questions, email us and we will respond to you.
And can you give us that email address? Is that handy?
So it's coronavirus@c-uphd.org. We have got thousands and thousands of emails from students, international students asking us about vaccines. I know most of them are already aware of this email.
Great, thank you. Andreas, we've talked a lot about the Delta spreading more easily than previous variants. And we know a lot of our instructional faculty are nervous and concerned. Should they somehow know and be able to notify their students if someone in their class tests positive?
Well, as Awais explained, Robin, the contact tracing process in place is the one that pretty much dictates the rules here. I want to emphasize one point. It is possible that a student may tell the instructor they have tested positive. And they have reasons perhaps to do that because they are not able to go to class, who knows what. The most important thing in that case is to keep in mind that this is the student's private health information, and the instructor should not share that information with anyone. That's a very important thing for all of us to keep in mind. The second thing that we need to keep in mind is that because a student tells them that they have tested positive, that does not mean that this is a call for the instructor to move their class online. Unless there have been information shared with them by CU PhD about related to contact tracing with the instructor or others in the classroom that suggest that that is something that needs to happen, they should not take the action to move their class online. As Awais explained, the contact tracing process that is in place is working. One of the questions that I know comes up, Awais, is do we have enough contact tracers to be able to meet the demand as it grows because of the Delta variant? Perhaps you can help us answer that question.
Definitely. So, we have hired a lot of contact tracers even during summer when cases were at our historical lows. We kept contact tracers because we had all this, again, institutional knowledge of contact tracers for the last 12 months. We are still hiring more contact tracers because, again, as people got other jobs, they have taken other jobs. We have been able to keep up with the current caseload and our goal of responding within 24 hours of getting the result. We have been able to do that right now. And like I already mentioned, we also have now the support of the state surge center, which has been set up by the state to assist local health departments in large surges of cases. So these are also contact tracers who are not stationed here in Champaign. They are remote, but they are all being trained to do the contact tracing in the exact same format as we have been doing. So with that in place, we are pretty confident that we'll be able to respond to any surges. Hopefully not, but if there are, we'll be able to respond to them.
Great. And just in case people weren't listening, because this is one of the most frequent questions we get, if one student in a class tests positive, should the class go online? Awais, you go first this time.
Yes. So one thing, if you tested positive, first thing you do need to do is go and isolate yourself. I think that is the most critical piece. The idea of testing and testing positive is so that you can protect others from getting infected. So first and foremost, you need to do is go into your room, isolate yourself, wait for a call from public health. Like I said, we do plan to respond. We call within the first 24 hours. If we do not, and if you have a positive test, you can always email us and let us know. But again, be patient. Like I said, we need to see that result in our system to be able to take action. So that's the first thing. When we do our case investigation, we do a case investigation to identify who those people are that need to be in quarantine. And just because you are in a class does not mean the entire class is exposed. Just because you are in a lab does not mean the entire lab is exposed. And again, with the excellent vaccination rates in your on campus, the chances that 9 out of 10 of the people in your class are already vaccinated. So even if there's an exposure, they will not be required to quarantine. So you don't have to stay at home. You don't have to be put in quarantine for 14 days like we used to do in the past. You can pretty much go about doing what you've been doing. We do recommend go get tested within 3 to 5 days, but that a lot of students are already doing.
But again, unless contact tracers tell me I need to go get tested, I don't even need to do that, right?
You don't. Again, we are only going to put people in quarantine if you meet the specific criteria, that is, if you are not vaccinated, if you were within 6 feet of someone for more than 15 minutes in a 24-hour period, that would be the only time where we would ask you to quarantine. And us outside of that, there is no quarantine requirements.
Great, thank you. Andres, anything else you'd want to add on that one?
I think Awais was perfect in answering the question, Robin. Nothing else to add.
Sounds great, thank you. And Becky, vaccinated or not, what do you do if you have some COVID-19 symptoms?
Yeah, regardless of your vaccination status, if you have COVID-19 symptoms, you should start quarantining yourself, make sure you're wearing a mask everywhere, and go get tested. But you should be aware that we're starting to have other respiratory infections circulating again, unfortunately. So other diseases might be responsible. If you've tested negative after having COVID-19 symptoms, you could choose to go get tested again, just in case. But you should also potentially contact McKinley or your health provider to see if there's another potential infection responsible.
Yikes. Okay. There's always all kinds of bugs out there, aren't there? Goodness sakes. So Awais, again, if I'm fully vaccinated and I definitely get COVID-19, what should I do at that point?
Again, I mentioned this earlier, Robin. If you tested positive, whether you are vaccinated or not, you should first isolate. You know, Chris mentioned this earlier, Becky's mentioned this earlier. The vaccine is not 100% in preventing the infection. So we know that you could be infectious and passing it on to others. So if you have tested positive, you could be symptomatic, you could be asymptomatic. First thing you need to do is to go and isolate yourself. And isolation basically means put yourselves away from others, whether it's family, whether it's friends, whether it's your colleagues. Do not come in close contact with them. You are anyways masking. Make sure you are masking and you stay at home. You will get a call from our case investigators, contact tracers. They will give you further guidance. I also know as soon as you test positive, you do get a notification from the university system as well. And the system also tells you exactly what needs to be done. So follow that guidance, especially with the text message that you receive, and there will be a follow-up call from public health telling you what next to be done. In most instances, what we have seen is if it is a repeat positive, or if it is a positive in a vaccinated person, you might end up having to isolate for 10 days.
So Awais, you have been one of the most calm people throughout this whole pandemic. Tell people, why are you calm? Why do you feel confident?
I don't know about that. You know, my colleague Julie Pride and most of you, I think almost all of you know, we do have you know, different personalities. She is very, very active to a point of hyperactive as well. So I need to balance that out. so that we have, you know, we have a well-established balance.
I assume you guys, probably more than anybody though, had to feel some level of calm when the vaccines came out, that knowing that there now is a light at the end, right?
Yeah, I mean, you know, I was talking to Julie about this morning as well. It's very unfortunate that, you know, last year at this time, we were giving people a lot more hope that the vaccines are coming. The expectation was that the vaccines will, you know, help in ending or at least controlling the pandemic. It's unfortunate. It's not unexpected. Again, Chris is the expert in viruses. He knows. Historically, that's never how it ends. It's always dragged for a long time. Viruses mutate. But again, I think if people do the right things, you know, if everybody takes responsibility and not only a few people in the community are bearing all the brunt of the responsibility, I think there is good news ahead as well. And I think that's what keeps us sane as well. And that's what allows us to go to sleep at night as well.
Thank you. That was lovely. Yeah. And Andres, one question we have gotten a lot that I've forgotten to bring up so far. Instructors are asking us a lot about when can you wear a face shield versus a face covering. So the shield would be the clear thing that comes down versus the covering.
Yes, you're right, Robin. And thank you for asking this question because it does come up quite often. And of course, instructors are permitted to wear a face shield during lecture as long as they're able to maintain 6 feet of distance from all others in the classroom during the entire lecture. I want to emphasize that. Typically, what we want to make sure is that when instructors enter in the classroom, they wear a face covering and they keep wearing it until they find the place where they're going to be lecturing from, a podium or whatever the lecturing space is. Then if they so choose to replace their face covering with a clear shield, and what I mean by shield is what you said, this face shield that we are all familiar with, they need to monitor their distance from the students. They need to monitor that 6 feet distance from everyone in the classroom. And one of the things that the faculty should consider also is the possibility of wearing a clear face covering instead of a face shield. It serves as a face covering, and at the same time, the clear surface provides them with the ability to make sure that every student in the class is able to follow their lips and understand better. I want to also take this opportunity, Robin, you ask why Awaze is so calm. I will tell you that one of the questions that comes all the time, and surprised me that Awaze is always calm, is that when it comes to the Delta variant, our people are telling us, look, Andreas, we're still learning about the Delta variant. You know, there is so much that we do not know about the Delta variant. And since we have the experts, Chris, Becky, please share with us. People are getting anxious that we do not know enough about the Delta variant to inform our decisions. How do you go about learning about the Delta variant? I want to hear your thoughts because, you know, I listen to you all the time and I have that benefit. And I know you talk to others as well, but let's make sure our audience has that opportunity as well.
Sure. I'm going to come back to the face shields for one moment. I appreciate the need for face shields in some circumstances, and I know how hard it is to teach in a mask. I've been doing that and it's tough, but I want to make very clear that the face shields are not as protective for you or for your students as the face masks. So if you are at all possible able to wear a face mask for teaching, I would highly recommend it for your own sake as well as for the sake of your students. But going back to Delta, and when we don't know so much about Delta, what are we going to do? Nothing about this virus has gone against basic public health knowledge. We know how to control respiratory viruses. We're learning better and better how to control this particular virus, but everything that we're doing, we knew about well before this ever hit. And we just need to be a little bit stronger and more careful about it. So we don't need to know absolutely everything about Delta to know what we need to do here. And what we need to do is vaccinate, test, wear masks, improve ventilation.
Yeah, I would second Becky's comments. You know, as Andreas, as you mentioned, there is a lot of uncertainty about specific aspects of Delta and other variants, but the key, most important point, you know, the utility and protectiveness of vaccines, there's not really any uncertainty there. And we know that they are massively protective against severe symptoms and hospitalizations, and that if you're vaccinated, your odds of getting really sick are so much lower than they were before you could get vaccinated. So I'm actually, you know, I'm very optimistic here. The vaccines still work. If you are vaccinated, you are in a completely different place than we were a year ago in terms of your risk level. And I just cannot emphasize enough, again, that everyone needs to get vaccinated. The risks associated with vaccination are so vanishingly small and nothing compared to the risks associated with getting COVID infection. At this point, this virus is here with us to stay, like many other viruses, and everyone is going to get infected at some point. And so your choice is, do you want to be vaccinated when you get infected, or do you not want to be vaccinated? And I cannot emphasize enough how much you want to be vaccinated. The risks are the risks are so much lower. So
Chris, that's funny you should mention that. I was just going to ask you if you had one piece of advice for people on campus, but I think you might have just given it.
Get vaccinated.
Becky, anything to add to that?
Get vaccinated and wear your face mask and watch the ventilation and the size of your social network for now, while we're still bringing everything under control. I agree with Chris that it is here to stay, but you can do your best now to avoid overwhelming those hospital systems. As Awais said, our medical colleagues are tired and we need to protect them. So get vaccinated, wear your mask, and keep your social network small.
Awais, anything to add?
No, I think it's been answered. You know, I was going to mention every one of us either knows somebody who has had COVID or knows of someone who's had COVID. And for us, you know, at Public Health, we know of people who have died of COVID. We have family members who passed away of COVID. And we have family members who've suffered because of COVID as well. So we have seen it firsthand. When I talk to my colleagues in the hospitals and they see the effect of Delta right now on the unvaccinated, the younger population that we see, the teenager that died in our county just a couple of weeks back, and majority of the deaths happening in the young population. It's heartbreaking to see that. And again, that's why, you know, like Chris mentioned, like Becky mentioned, vaccinations is going to be the #1 strategy. And while we get everybody vaccinated, all the other strategies have to be implemented at the same time.
Very well said. Thank you. And Chancellor Jones, we've about run out of time. I'm going to give one quick PSA for our friends at Facilities and Services. In the central stores, they do have the clear masks, so the face covering, not the shield. So if you would like, they absolutely have a supply of those. And Chancellor Jones, would you like to have any final remarks before we close for the day?
Sure, just briefly, I would just like to say thank you all so much for a very thoughtful and comprehensive response to a lot of critical questions that are top of the mind for people in our community. And I can't thank my colleagues enough for taking time out today. And it's been gratifying to know that the Delta variant is not the Godzilla or King Kong of viruses, that it can be defeated if you vaccinate, test, and wear your face covering. And we will make it through this academic year as safely as we have in the past. And this will once again be one of the safest places to be in the state of Illinois, if not the nation and the world. Thank you all. Thank you for participating, each and every one of you.
Thank you, Robert. Thanks to Robert Jones, Andreas Kangaleras, Awais Vade, Becky Smith, and Chris Brook. Also, thanks to my colleagues in Public Affairs, Allison Vance, Chris Harris, August Schuss, and Katie Watson, as well as the team at Tech Services, especially Drew McGregor, who've all helped make these meetings happen. And thank you especially to Ellen Denny and Rebecca Lashmar, who both have provided live captioning for the briefing today. If you haven't already been vaccinated and you're able to do so, you can look for an appointment on vaccines.gov. And I think a show of hands on everybody in the panel who says get vaccinated, and it looks like 100%. If you are vaccinated, have not yet uploaded your record into the My McKinley portal, do that today, please, so we can get those numbers up. And if you're having trouble uploading, we can help you with that as well. Just call the Wellness Answer Center, 217-333-1900, and those lovely people will help you do that as well. They are wonderful. They've answered thousands and thousands of questions throughout this, and that is a very easy one for them to answer. And remember, this briefing and all the briefings are recorded and posted on the covid19.illinois.edu website. So if there's something that you heard today but you didn't catch fully and you want to hear it again, or if you want to share this with your friends, please do so. We want to get the word out. We want to make sure everybody on campus knows the best ways to manage this and to get on with your lives. So thank you so much for joining us today. Get vaccinated and have a wonderful weekend. Bye-bye.